This is a special day for Plateau State as we make history with yet another important aspect of our rescue mission in the health sector. It therefore gives me great pleasure to officially launch the Plateau State Contributory Healthcare Management Agency as chairman.
This administration has further demonstrated its willingness to reach the unreached, thereby creating equity and efficiency.
One of the greatest legacies that the rescue administration will leave is this social health insurance scheme.
I said, who was I going to appoint? So I called him and said, James, you people were the ones shouting national health insurance. Go there and do the best.
When we came on board as an agency, we saw the wisdom to take a study tour of states that have distinguished themselves in the business of health finance and governance, with the aim of creating a hybrid agency.
This is something that has not been done before, and therefore if we are going to succeed, we must be fully involved and making sure that our people also get involved.
This health insurance scheme have come to take our people out of poverty.
We've heard it from our federal civil servants. And honestly, we've been looking forward to when we'll have it on this in Plateau State. And today we're launching this great, wonderful, and very important scheme.
This scheme is open for all Plateau residents in the formal and informal sectors, together with their families.
We have looked forward to a day like this, and we are very happy that it has come. I want to assure His Excellency and the agency, my good friend Fabon, that we are ready for enrollment because we are more organized, communities are very much organized, and there are actually people who are supposed to enjoy this first because they don't have any kind of protection. The ethnic nationalities are ready to be enrolled.
This is a great step towards achieving universal health coverage in Plateau State, which is in line with the Rescue Administration's first pillar thrust of peace, security, and good governance. This is why we established Plateau State Contributory Healthcare Management Agency, LACHEMA, to serve as a vehicle to midwife the attainment of universal health coverage in Plateau State. This development is definitely a game changer.
Your Excellency will be proud of the systems that we have created for recruitment of people. Seated in your room, you can enroll. In this hall, you can enroll. Anywhere you can enroll. Farmers on the farms, market women, places where there are no internet access, you can enroll. That is the innovation that we brought on board.
We are working towards designing a model for all the state legislators on how we can enroll some of our constituents, household by household.
My hope is that the takeover of this scheme will guarantee access to quality and timely healthcare services for the elderly, physically and mentally challenged, children less than 5 years, orphan and vulnerable children, pregnant women, and the internally displaced persons who at the moment face difficulties. I enjoin traditional, religious, community and political leaders to join in sensitizing and mobilizing the people towards enrolling into the scheme. By this launch, we are equally commencing the enrollment of our citizens into the Plateau State Social Health Insurance Scheme.
As the #1 citizen and the #1 enrollee under the State Social Health Insurance Scheme on the Plateau. Thank you, sir.
A round of applause as we speak in the name of the Plateau. A round of applause.
this point, thank Mr. Speaker and honorable members of the Plateau State House of Assembly for giving due consideration to the Platema Bill and passing it into law, which gives us the legal backing to hold this ceremony today. Similarly, I wish to appreciate development partners who have played various roles in ensuring that we come this far and impact the health and well-being of our people. God bless Plateau State.
Evening. Yes. Pleasure is mine. Yes. Thank you.
Like I said,
Thank you, Lord. Platema is the Plateau State Contributory Health Management Agency, which is also known as the State Social Health Insurance Scheme. It was established in June of 2009. His Excellency, the Right Honourable Doctor, gave his assent to that bill that was passed by the 8th Assembly. And basically, we are saddled with the responsibility of seeing through the United Nations Sustainable Development Goals of achieving universal health coverage for every resident on the plateau at a cost that is affordable. Now, the concept of universal health coverage simply means to bring about promotive, curative, preventive and rehabilitative services of sufficient quality to the people of Plateau State. So that's the summary of what the State Social Health Insurance Scheme entails.
Okay. So who is now qualified to enroll for this insurance?
Split under the scheme.
How do you get to enroll? Benefit from it. So what about?
We created 4 platforms through which people could enroll into the scheme. The platform number 1 is called the Plateau State Equity Health Plan. And this is funded by nothing less than 2% of the consolidated revenue fund of the state and that of the local government to care for vulnerable people. Now, vulnerable people have been further classified into elderly greater than 65 years of age, those who have served and have retired, children under 5 years of age, pregnant mothers, orphan and vulnerable children that have been verified and registered under the Ministry of Women Affairs and Social Development. Then we have Plateau residents living with disabilities, Plateau residents with mental illnesses, and most importantly, the internally displaced persons. So this group of persons do not pay anything to qualify and benefit from our services. And the bulk of vulnerable people live in the rural areas and in the villages. Then we have the second platform as formal sector people. You are either working in the local government service or the state government service or the organized private sector. You also qualify to benefit from this scheme. But we have a large population of people who are in the informal sector. These are farmers, artisans, market women, youth groups, and all people who do not have any direct connection with government as far as a job or taking remuneration from government. Now, this forms over 70% of the population of the people on the plateau. They also have a platform through which they can come under the scheme. And then the last platform for us is the Plateau State Private Health Plan, where people could approach us to get additional services that are not entailed in the minimum benefit package of health services, they are also qualified to participate in the scheme. So in a nutshell, irrespective of where you live on the plateau, whether in the urban setting, in the rural setting, the most remotest part of Plateau State, you have access to quality and affordable healthcare services, courtesy the Plateau State Contributory Healthcare Management Agency.
Okay, so one will ask, one enroll online, but necessarily coming to the office.
Yes, we have perfected that, and we have made provision for people to enroll online. How you get to enroll online is very simple. We have a call line which is toll-free. It has been financed by the agency, and that line is 0700 752 8328. 0700 752 8328. The moment you call that line, someone is up there to listen to you, and then he will direct you as appropriate by giving you the coordinates on how you can use either your Android phone. And then we have made payments also very easy, especially for those in the informal sector. The premium for people in the informal sector is just 12,000 naira per annum, which is renewable. But because most of our people earn their income on a daily basis, you could begin to pay premiums by even 36 naira 80 kobo on a daily basis, or 250 naira on a weekly basis, or 1,000 naira on a monthly basis. And we have codes that you can use, the USSD codes, to just dial, and then your money drops into our account. As simple as that.
Wow. Okay. So let's talk about the area of coverage and the facilities that this insurance covers.
Yes, practically we have a total of 569 healthcare facilities across the state. We have diversified to the extent that both private and public healthcare institutions give services under Plus Chamber. For instance, we have 26 pharmaceutical stores across the state that are open to give emergency services. We have 18 cottage and general hospitals across the state. Then we have 87 other private healthcare facilities and a whopping 325 primary healthcare centers across the state that give services both in the rural and in the urban setting.
Well, the question I'm going to ask you now, I mean, to what extent do Plateau State as a government invest in it?
Well,
this is a public institution.
Okay, that's a massive question. You know, at the start of the operationalizing the scheme, we had skeptics all around because they believed that it's one of those government policies. But the government of Plateau State, under the leadership of the captain of the rescue administration, the Right Honorable Dr. Simon Bako Lalong, has demonstrated massive political will by creating the biggest safety social net that has existed in the history of this state. And I start by saying this. If 2% of the consolidated revenue fund of the state and that of the local government is paid as equity fund, those who know their figures very well will have an idea of how much government is investing in the equity fund. For the formal sector, we only take 1.75% of the basic salary of the employee. The employer in this case, which is the state government or the local government, gives 3.25% of that equivalent to make it 5% for them to benefit under the scheme. Now, the informal sector, if they say you just pay a premium of 12,000 naira per annum, at a go, 12,000 naira cannot treat malaria and typhoid sepsis. But if they say you just pay 12,000 naira, it means somebody somewhere is subsidizing for the huge amount of expenditure on healthcare services. But most importantly is the fact that the federal government and the state government are contributing into the basic healthcare provision fund, where we have a whopping 28,735 people who are currently benefiting from these services free of charge. So in a nutshell, I make bold to say that the government of Plateau State is contributing hugely and very massive resources into this safety social net so that no one is left behind.
Okay. So outside the scope of government, do we have any organizations, like the non-government organizations or even United Nations organizations, international organizations, any contribution from them?
Yes, when we started the Basic Healthcare Provision Fund, where the state government have paid counterpart funding of 100 million at the start, we have the Bill and Melinda Gates Foundation donating monies for vulnerable people in this country. The World Bank is also donating money for vulnerable people in this country. But most recently, because of the sterling performance of the Plateau State Contributory Healthcare Management Agency, which has been recognized nationally and internationally, the USAID funded local health system sustainability project came to us. So USAID is supporting us in so many areas so that we can increase the number of people that are currently accessing care under the Basic Healthcare Provision Fund and the State Social Health Insurance Scheme.
Okay. So as an enrollee, I have a right to know. I have my rights. Know my rights and also my privileges. So what are those rights as compared to those privileges I have as an enrollee?
As a matter of fact, for us, that is the hallmark of the job that we do here. Until a beneficiary knows and understands how to enforce his right, we may not get some of those sharp practices or short changes corrected. First, at the point of enrollment, all beneficiaries or enrollees have a right of choice to facilities. Under the State Social Health Insurance Scheme plus CHEMA, we do not enforce facilities on people. And so one of the rights of the enrollee is to know that he has a right of choice to facility. Number two, an enrollee has a right of change, to change this facility when he's shortchanged or when the facility is not meeting his demands. Number three, an enrollee has a right to complain due to either poor quality of services or when these facilities are not attending to him. An enrollee has a right to walk into any of the designated facilities or pharmaceutical stores we have to access quality medicines if his healthcare facility does not give him those medicines. Our enrollee has a right to dignity, they have a right to confidentiality, they have a right to quality healthcare services. And most importantly, our enrollee has a right to voice their complaints where necessary, and of course their confidentiality is assured. So until the enrollee gets to understand some of these rights and privileges, then he may not get quality services as at when due. So those who are listening to us know that you have the right, because the hallmark of quality assurance for us is having enrollees speak to us using our outlets of listening to complaints, and then we could meet them at the points of their needs.
Well, talking about rights, I just want to inform our viewer that you can send in your question. If you're on Facebook, just type your question there. If you're on YouTube, also type your question. Also, if you're on Twitter, just tweet it. Let's see. So we get to ask Dr. Fabon now what your own concern is. So that's talking about rights, by the way. Now, apart from rights, it's one thing to know the law, and your right, and all sorts of things, but the orientation, to most of our people, because you've gone to my establishment, we're asked to register, we can register, like I said, but for me to know my rights, it's going to be something else. Seen in this country, and I give you an example. I was in one hospital, certainly not your insurance scheme, but then the man came, he was supposed to buy drugs, like 3 times, and they told him, look, can't get drugs here. No, so kindly go buy outside. So he said, no, he thinks that if they are not going to give him money for it, if they are not going to give him drugs, they should pay for drugs or fund his money for him. You see, that's a conscious citizen. Let's say the opposite. How will he know his rights?
Yeah, no matter how good government policies are, it's the responsibility of the agency that is responsible for making clear those policies of government to the people to do that. If not, those policies could become obnoxious policies. So when we came on board, we started by sensitizing the people, having advocacy meetings, and I'm bold to tell you that Plus CHEMA as an agency has carried over more than 1,000 of those sensitization meetings and advocacy meetings, including sensitization in villages and organizational meetings and the likes. And we've shared more than 10,000 copies of the enrollee handbook. And enclosed in the enrollee handbooks are the minimum benefit package of health services. Now, what's our minimum benefit package of health services? They are the list of diseases that professional bodies and stakeholders have agreed and have developed through part dependency, that it has contributed largely to the morbidity and mortality of our people here on the plateau. And this list of diseases are basically classified into emergency care, primary care, secondary care, and tertiary care. And also in our enrollee handbooks, we have list of facilities, and then we have penalties, we have rights of enrollees clearly written there. And in most of the primary healthcare facilities, or the entry point for each of our beneficiaries, we have stickers that have written boldly what are the rights of the enrollees, including pharmaceutical stores where you could access medicines if such facilities shortchange you or do not give you medicines because of cost and the likes. So this opportunity that we have with ViewPoint is further giving us a large latitude to tell our beneficiaries that when you go to any of the primary centers, which is the point of entry, look at their boards, look at their doors. You will see stickers with rights of enrollees, stickers with pharmaceutical stores where you could walk to get medicines, and then you will also have a right to know what is the scope of coverage that that facility of entry provides to you. And of course, we are pretty sure that sensitization is not a one-stop shop thing. It is a perpetual continuum for us, and we would continue to sensitize and advocate for the rights of our beneficiaries and enrollees until no one is left behind.
Okay. Well, I think you are very clear already. But the cost of your discharge of duty, do you have any cost? Did you register any HMO or something like that?
Yes, we have had lots of complaints from our enrollees, but that apparently stemmed from the fact that most of them do, and of course it further strengthens the resolve of the directorate at the agency that is responsible for health services, standards and quality control to step up their job and police most of these facilities. We have had cause to Belize Health Maintenance Organization, at least one for now, and then we have some who are presently under close. It gives room for redress, it gives room for corrections, and until we get to that point, a health maintenance organization does not keep in accordance with the operational manual of the agency, then we will delist. We also have situations where we had to suspend some facilities until they upgraded their facilities before we reopen them for access of care to people.
Okay, so what was your target? By the beginning of this organization, what was your target? And how many have you enrolled now? And what are you thinking in the future?
Okay, that's a very brilliant question. I must confess that, we are the pioneers of the agency. And when we started the agency, we had to pull in stakeholders to help us design some accountability framework and then help us chart a way towards reaching plateau people, the nooks and crannies. And we started precisely September of 2019, and by the 15th of September 2020, we had flagged off the scheme and commenced enrollment of the informal sector immediately. Then we commenced enrollment of the formal sector on the 4th of January 2021, and then we commenced access to care specifically on the 27th of April 2021 at the 7-day Adventist clinic in Jingri, and we flagged off that access to care in the informal sector. The formal sector kicked off officially 2 weeks after a flag off of the informal sector. Now we set up, as I mentioned earlier, some accountability frameworks, but prior to even enrolling people, we did what we call a baseline survey. A baseline survey it took the statistics of what health insurance is. We looked at coping mechanism of people with catastrophic out-of-pocket expenditure. We look at support systems in family. We look at willingness to pay, and then we look at the number of people who suffer catastrophic out-of-pocket expenditure. I make bold to say that the statistics that we had placed at 94.7% people suffering catastrophic out-of-pocket expenditure, and a whooping 74.8% of people are in the informal sector. Yet we have an appreciable number of people attending
catastrophic out-of-pocket expenditure.
Yeah.
We are talking to mass.
Yeah, catastrophic out-of-pocket expenditure means that people go through untold hardship to dip their hands into their pockets to pay for health services. And that is the degree of the suffering that the people on the plateau had. And then we had a whooping 54% of people accessing antenatal services, and then that means that more people have to pay more money to access care if they are ill for that reason. So we look at a population of 4.7 million people, and then we set standards, and we said in the first 1 year we should reach 500,000 people with the scheme, and then in 2 years we should reach at least 1 million, and then in 10 years we should cover 50% of the entire people on the plateau. When we are moving, as I mentioned earlier, under the Basic Healthcare Provision Fund, out of a possible 35,438 people, we have covered 28,735 people who are currently accessing healthcare services. At the level of the informal sector, we have had public-spirited individuals on the plateau help us enroll a whooping 400 people, and then we have the numbers counting by the day on our dashboard. At the level of the local government, we have enrolled 901 people out of a possible 14,806. And then, of course, at the state civil service, we have enrolled 21,129 people, principally, not to talk of their dependents and the like. So if you make this multiplication and make bold to say in the 1 year,